Hello, everybody. My name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. Today, we'll cover one piece that hasn't been covered in the subjective yet in the history-taking portion, and I don't know how I missed it, but it's huge. Have you had any treatment for your symptoms yet? Some patients know, right? This is the first time that they're ever experiencing physical therapy is in your presence. And as a clinician, that's something that we have to make sure that we understand, that we don't have the luxury of understanding what didn't help or helped that patient in the past. Now, as a patient, you have valuable information inside of you that we would really like. If you've already had therapy in the past, I want to know what helped you. Now, this is like, some patients struggle with this definition of help from our perspective, right? I don't care what made you feel good. I'm right at you. I don't care if it made you feel good temporarily. I care if it made you feel good later that day, tomorrow morning, the next day. Was this something that actually lasted that made you feel better? Or did you walk out of the clinic feeling good and by the time you got home, your symptoms were back? Because there are some Jedi mind tricks that we can play, right? Seriously, though, there are some things that we can do to trick your brain so that way you stop feeling pain temporarily. And that's an easy selling point, right? Well, how did you feel when you left the clinic last time? I felt great. Awesome. Then you should come back in so you can feel great again. It's an easy selling point that we have with patients. But our job isn't, well, my job, I'm not going to speak for everybody else. My job isn't to sell you for you to keep coming back into me. My job is to try to make you better. As a team, we work together so that way you can get the benefits. So I'll typically ask patients, what have you tried in the past and how did it happen? And these are the camps, right, that you'll tend to hear. Well, I walked into the clinic. My therapist said, "Hey, how you doing?" And before I could even tell the therapist how I felt, they told me, go ahead and start off on the bike, right? That's the first camp. The camp is, my therapist didn't really seem to give a crap about whether or not I was there and just wanted me to go around and carry a clipboard and do what I needed to do. That's the first camp. Second camp is, my therapist laid his hands on me for a long period of time and then asked me how I felt. And then he wanted me to come back to lay his hands on me again. Third camp is, you got a bunch of exercises with no real rationale and they gave you 20 home exercises to do and you didn't do them because there were 20 of them, right? I mean, it's just unrealistic. But then there's the camp where they tell me, well, the therapist really tried to figure out why I was having symptoms. Okay, awesome. If that's the camp and you've been through that, I get excited, right? If I get really excited about therapists that have tried to figure it out and now the patient's in my presence, because now I get to try to figure it out, right? And I get to, it's almost like a big chess match, me against your symptoms and me against that other therapist, right? But if your therapist was one of the other camps, they didn't really care, they didn't really try, they didn't really think, then you're coming to me and it's still like you had never seen therapy before in the past. Because the one thing to get through to you is not all therapists are the same. Just because the therapist has doctor in front of their name doesn't mean they're good. There's that old running joke, what do you call the person who got the lowest grade in the class in the doctorate program? Doctor, right? So just because they got a doctorate does not mean they're good. It just means that they made it through the program. That doesn't mean that they actually learned enough to treat you. They just made it through the program. And you need to understand that as a patient. Because you want to see somebody who's good. You're paying for somebody who's good. Well, your insurance company is paying for somebody who's good. You're paying for premiums. But it's beside the point. So you're giving money to somebody who should be good. So make sure that you get that. If you don't feel that they're trying to figure out your symptoms, walk away. I've said it before. Walk away because you can. You're not married. You're not in a contract. You can easily leave. That's it for this session. I'll be coming back with the objective portion and where we actually become active and stop asking so many questions. Thanks for watching.